a lot of work on ground and on field. So this time I'll leave you guys to talk quickly about it. And starting with Dr. Shuchin, top cities are in lockdown, and many might even extend the lockdown. But with we are seeing a little positivity in the terms of number of cases are slowly reducing, and things are seemingly a little better, but I still don't think we should drop our vigilance, doctor. So I wanted to understand from you, what are the key steps we need to keep in mind to be prepared, and ensure continued safety.
Yes, thank you, Sindhu. So definitely, as you said, the cases are going down, and it's a very encouraging sign. But as we saw last time as well, it's not very necessary that these cases will stay down. The virus thinks of different ways in which to mutate and come back. And uh, currently, we are seeing only antigenic drifts. So viruses mutate in two ways. Usually, one is a drift in which they drift slowly, having one mutation or two mutations at a time out of the hundreds and thousands of amino acids they have. But sometimes they suddenly undergo a shift in which there is a massive mutation and the virus can become almost completely unrecognizable from its previous version. And that is the time in it when there is no role of previous immunity or previous vaccination. And this occurs very commonly in the common cold virus, which we call as the influenza virus. There are three types: influenza A, B, and C. And A and B are usually responsible for most of the serious illnesses. So we need to make sure that we don't allow the COVID virus this window of opportunity to undergo the antigenic shift. The easiest way to do it is for everyone to go and get vaccinated as soon as possible. So if you do get a chance, any of you, please do not wait, do not think, do not call us to ask whether this vaccine is safe or whether this is not. Should I go and take the vaccine? Should I wait for Pfizer to come in? So please do not do that. Please go and get yourself vaccinated as quickly as possible. That is the best way to make sure that the third wave doesn't come in. Of course, in the rest of the things, until and unless you get vaccinated, and even after you get vaccinated, because till the time the entire community is not vaccinated, we none of us are safe. It's like the pulse polio drive we used to do 10 years ago. Polio got eradicated from India in 2011. And till that time, if you remember, there were these pulse polio Sundays in which every Sunday we would vaccinate about 14 crore children in one day. And that was the initiative because everyone needed to be vaccinated at exactly the same time. So the virus would not have even one host to go and stay in.
Mhm.
Unfortunately, this is not looking very possible because we can't vaccinate like 100 crore people a day. But till the time everyone is vaccinated, please make sure that you take care of SMS. SMS is, as we always say, social distancing, masks, and sanitization. So please do not go out unless and until it is very important, especially not for parties or religious gatherings or any other purpose which can be solved at home. Conferences like this, in which we can chat with each other sitting at home. Please keep a mask always on your nose and mouth when you are in contact with anyone, let alone strangers. So it is anyone who's going outside, even in your house, if somebody is going outside for work and coming back, everyone should wear a mask. All children above 2 years should be wearing a mask, even at home, if there is even one sick person or anybody who's suspected of being suffering from the infection. Please be safe. This is all we can offer right now. Unfortunately, we do not have any particular medicines to keep you safe other than the vaccine. Until the time you don't get the vaccine, just make sure that your surroundings are clean and you do not expose yourself unnecessarily to the infection.
Right. Mudit, in on those terms, I just wanted to understand. You've been working for the past 2 years quite strongly in helping consumers and even hospitals to reduce the impact on the healthcare infrastructure. Like Dozee is focused on trying to make every bed into an ICU bed. Even your home beds can be converted into ICU bed. So, could you tell me a little bit on the work you're doing?
Sure. I think you gave a very good pitch. Any bed can be converted into a step down ICU, not in an intimidatory way, right? I would say, not the wires and electrodes. One of the differentiating factors about Dozee has always been that it's contactless, so it goes under the mattress, so you don't even realize that anything is there, and it continuously and enables you to collect data. And even Dr. Shuchin can kind of tell you about it, but a lot of things, right? Especially when it is about monitoring becomes very important as well, especially after you are infected, because the way this virus progresses even in the body, right, at certain times it can be very unpredictable, right? We uh, it is not the case right now, but there was a situation when getting a bed was a 48 to 72 hours lead time, right? So you don't want to be like in a SpO2 level of 60 and 70 and then you are finding the bed, then it can be disastrous, right? So what we offered in this time was that at home itself you can continuously keep a watch on yourself, your doctors can keep a watch on yourself, and even we also worked with different third party telemedicine companies as well to keep a continuous and a very strict ward. So it was almost like a virtual COVID ward without having going to be in one, right? So that was one. So there were cases, right? And in fact, many users wrote to me as well, and that was very heartening. After all this time, you do realize that why you are pushing yourself so hard and everything. But when you get a message like this, that for my dad, Dozee was really life saving, because we shifted him when it was only dropping till 85, and by the time we reached, it was 70 SpO2 levels and respiration was 48, right? So we don't know what would have happened if we were 1 or 2 hours more late, right? And we really think, and today my dad is back after being 5 days in hospital, and all thanks to you, right? So that really motivates us to put even extra mile, right? So that was one part of it, as you mentioned. The second is in hospital, right? So we did see that the entire healthcare infrastructure kind of falled off with the amount of load that was there. Imagine what happens to the nurses and doctors, especially inside the wards, right? Inside the PP, they have to be in 8 to 9 hours and giving a very high grade care. It's not humanly possible, to be frank, right? I don't know how Dr. Sachin can tell, but how even humanly they are able to pull this off. And I'm so glad that we are able to, at certain level, we are able to get this wave down. So hats off to them. But trust me, if at all anything like this comes again, it's and then we can't expect them to deliver at every single time, wave one, wave two, wave three, right? So what Dozee does over there, it automates a lot of their work, so they don't have to manually go and collect the data and things like that, right? So that Dozee is doing automatically for them. So it saves there almost 20 to 30% of time, which is huge in itself. And then also one nurse can monitor 100 to 150 patients from remotely, without being having to be inside a PP and things like that, right? So imagine how much of a difference that can create, right? And then third point is also the improved patient outcomes, because what you are replacing is that 3 to 4 hours check with a continuous, every second, every minute you are being monitored. So you are not waiting for again, inside hospital as well, you are not waiting for adverse event or code blue event to actually trigger to actually do anything. You can preemptively take actions, right? And that has so far in wave 2 alone saved close to 500 lives, right? So that's the kind of impact that we were able to create in last 2 months as well, right? So yeah.
Great. These stories are quite encouraging, and like you rightly put, Mudit, the doctors and the healthcare staff have been stretched beyond the limit. I don't know
I don't
where
know how they have pulled it off, right?
yeah,
Yeah.
and it's how they have pulled it off. It's hats off to them. It's just hats off to them. Dr. Sachin, coming to this, and since we are on the topic of home healthcare, I just want to understand the number of cases that children are getting impacted are growing. That is something, and I think we are conditioned to worry a lot about our young, and kids are getting impacted, children are getting infected. Fortunately, I'm guessing, I don't know, I hope my data is right, that children are not, it's not that fatal in them, but it's not something that we can ignore as well. So, how is Project Step One working in situations like this? How can home health care help in situations like this? Because it's very difficult for children to, be masked up and follow. Adults themselves don't follow it. So, asking a small child to do it is a little difficult. How do you do that? And how is Project Step One working in the whole overall home health care space?
Right. So, yeah, speaking about the healthcare workers and their response to the pandemic, I think it has been exemplary. I cannot thank all the
Yeah.
doctors and the nurses enough. We've seen in our hospitals, everyone was, of course, on duty. I was also on duty. I usually don't do a lot of clinical work, but I was also on ICU duties for a long time. But the fact that even when they fell sick, they would be in the ward, and they would actually speak to us like this, that now it's good that I am sick myself, so I don't need to wear the PPE and I can take care of the other 10 people in the ward. So you don't have to worry too much because I'm admitted anywhere. So, and many of them lost their very dear loved ones, and they would go just for a day, do the rituals and come back and get back to duty. Not one of them stepped back and said it's too risky for me, I will not be coming, I've lost my father, I've lost my uncle, I've lost my brother. But everybody, I mean, I think it was just too much adrenaline at that time. Nobody even had the chance to stop and think what was
Mm.
going on.
Yeah.
But now I think every one of us needs at least a couple of psychiatrists for the next 10 years at least. So,
Yeah,
mental health of medical workers, I think, is something to be looked at very seriously uh, in view
Yeah.
of the pending third wave. I don't think too many of us are ready to do all this all over again in a couple of months, because that will be so, let alone physically, but mentally, it will be a big drain. And as you said, unfortunately, and God forbid, if this starts affecting the children, then I don't think anybody has the mental strength to bear any of it. I mean, seeing children in trouble is something which is completely next level. And you can't treat children like small adults. It's not like, you're giving a 1 gram dose to an adult, so you give a 200 milligram dose to the child because he's 20 kgs and the adult is 100. It doesn't work like that. Children are completely different ball game. They have different equipment, they have different manpower needed, they have different medicines, everything is different. So we really need to protect the children from the coming wave. The And how step one is helping is, I think, again, exemplary, because of the fact that we are seeing very different symptoms in children. It's not very classical that the child will have exactly the same sore throat or fever, loss of taste, loss of smell. They may not be even to explain that there is a loss of taste or a loss of smell, right?
True.
They
True.
may not be able to explain clearly what their symptoms are. So we've seen children who've been scolded by their parents because they've been lethargic, they've been sleeping, and the parents are telling the doctor who's calling them that he's just sleeping, he doesn't want to attend his online classes, and he's so lazy. And after 3 days, we find out that now they're developing fever, and then they're getting tested, and now they found out that it is COVID. The child was just lethargic, refusing to get up, refusing to eat. That was the only symptom that the child presented with. Many children are presenting with just gastrointestinal symptoms, just diarrhea and vomiting. That is all. They don't even have fever. So children have very atypical symptoms and they're not able to explain themselves clearly. And of course, as you said, Sindhu, it's very difficult for us to enforce masking and sanitization and hand washing. It's innately not in a child's behavior to do that. And in the past times, we used to actually encourage this, that saying that this will develop their immunity more, right? Let them go and play in the mud, let them have exposure to a lot of bacteria and viruses so that their innate immunity develops more rather than just confining them at home. And now we are doing exactly the opposite of that. We are just making them stick to their rooms, not even allowing them outside, because outside their room somebody is sick in the next room, an adult is down with fever, whatever, and it's very difficult for them. So in the future wave, I think the first thing, as I said, is to try and make sure that all the parents of these young children are at least vaccinated,
Mm.
because in the unfortunate circumstance that you have to get them admitted to hospital, it's impossible for a hospital to control these children or take care of them. As Mudit said, even for an adult, it's very difficult for PP laden kids, health workers to take care of the adults. The adults are so scared of seeing all these PPE kit, people roaming around. They seem like zombies completely. And imagine you leaving a 4-year-old child there. The child will completely go bonkers and he will drive everyone crazy around him as well. So you need the parents to be there, and the parents cannot be there if they're not vaccinated. So
Mm.
first step is to get them vaccinated, of course. Second is, as I said, to make as much of sanitization in your life as possible. If you're coming back from work and you have children at home, make sure that you call ahead. Make sure somebody is there at the door to open the door for you. You don't touch the door unnecessarily. You keep all your belongings, phones, keys, everything outside. Sanitize them and keep them outside for at least an hour. There's a bucket of water outside the house for you with soap and water. You wash your hands and feet there. After that, leave all your footwear outside as well. After that, go straight to the bathroom. Do not stop anywhere. Take off all your clothes and put them in a bucket full of soap and water. Have a very good bath along with a head bath. Wear fresh clothes and then only come outside into the house and meet your children and other relatives. So this is something that all of us need to uh, get into our practice. I think all these practices were integral to our lifestyle. I think maybe due to the fact that we had this big pandemic in the last century, which we all forgot about, and we had crores of Indians dying before because of that. And I think because of that, we had this, that the bathroom was outside the house. Everybody used to have a bath while coming in. Everybody used to leave their footwear outside,
Mm.
change clothes, everything.
True.
I think we need to get that back into the system. This is the first important thing. And second, obviously, teaching the children as much as possible. I know it is difficult for us, but we have to start somewhere. So we have to teach the children on SMS, on how to keep themselves safe, on masking. So masks should now be as integral to their lifestyle as we are, teaching them to wear clothes. So
Yeah.
they don't go outside the house without clothes. They don't even roam in the house without clothes, right?
Yeah.
So we have to teach them that masks are as integral to their lifestyle as clothes are.
Right. There's a question here. Someone is asking, can parents be carriers of the virus for their children even after vaccination?
Yes, of course. As I said, vaccination, think of vaccination as a seat belt, right? As wearing a seat belt does not prevent you from having an accident. It only makes sure that if you have an accident, you don't get seriously hurt. So a vaccine is similar. It doesn't prevent you from getting infected, but make sure that you are not seriously ill after your infection. So you can be infected and you can infect others. So wearing a seatbelt does not allow you to drive rashly or keep hitting other people, right? So similarly, having a vaccine does not allow you to roam around without masks. You can still hit others, you can still infect others. So wearing a seatbelt, of course, is necessary, but it does not, allow you to drive your car rashly. So people can still be carriers. They can still infect their children. That is why I said you need to be very sure that you cleanse yourself thoroughly before you enter the house, and you always have to wear masks and face shields when you're outside the house.
Right. Mudit, I just want to get to you and understand one thing about, you work for a startup that focuses on healthcare and home, making healthcare simpler and easier. And even at home, people can be safe. So, what steps do you think people can take? As in, you have personal experience in this during this
Yeah,
pandemic as well. So, I want to
no.
understand from you what steps can individuals take so that they and people around them are safe?
So, Dr. Bajaj actually put in some very wonderful points. In fact, it was very enlightening for me as well. Especially the seatbelt analogy, I really loved. I'm going to take that back from me and tell it to 10 other people. So, great one. At the same time, I would say few things. Also, few points. Also, I wanted to make was it is not just about COVID as well, right? There are other things as well which will also come along, especially because of the treatment load as well, right? Including people who have got treated, steroids and number of other drugs which were administered, right? So body has taken a big toll as well, right? So it's not just about COVID as well. We have to get prepared for next wave of COVID, as well as I would say other non-communicable organ disorders to everything as well, I would imagine, right? And I'm already talking to doctors and they are anticipating that and seeing that the number of heart attacks and everything, given the number of steroids and everything which have been administered, it can particularly go up, right? Especially for diabetic people and so on. So, few things apart from what all doctors Bajaj said about controlling the COVID, he has, I think, covered very beautifully everything. I would say, adopting back to the healthy lifestyle, right? Avoiding junk and everything as much as possible. I know it is difficult, but doing some certain kind of physical activity in house, yoga, maybe running on the hall, running on the roof, right? Maybe doing very early morning run, walk, right? I think that's a good idea. Still following all the precautions, of course, but we have to take care of our health. Also, it is a responsibility, I would say, right? Not going and ensuring that we are safe is going to put lesser burden on hospitals, and it is preserved for only needy. So it is as much of a responsibility for each one of us as well. It won't hurt for us to keep a continuous check on our health as well, right? And if there is anything Dr. Bajaj's team is actually running it, a lot of telemedicine help is available, right? He did mention before we started, I think you want to bring that up, but 1 million calls a day his team is handling, and now brilliant, right? So if things can be handled in infancy stages, such initiative can help, where we are not putting load on the public infrastructure. We are ourselves also trying to plug in these pieces with more data, with continuous monitoring, so that if that you are healthy at 60 beats per minute. I'm giving a very simple example. When it has started to increase to 72 and now it is 80, something is starting to shift already, right? So take preemptive actions, right? It's that critical. And it's, as I mentioned, it's a responsibility to keep a load lower on the infrastructure till of course it comes back to its normal again, right? So yeah, that's just 2 cents I would add with what little experience I have.
You know, I was going to ask Dr. John the home health care systems and what caregivers can do. Like if someone is tested positive, if parents are tested positive or children are tested positive and they don't need immediate hospital attention, what can be done at home? What can caregivers do at home? What can they keep in mind so that they themselves also stay safe and they can help someone recuperate and get better?
Yes, so Sindhu, I think the most important thing that we all need to keep in mind is to identify the red flags. So we should know when to start home isolation and when to end it, because getting, as Mudit said, Dozee helps you identify when you should not be at home, right? When is the time to get to hospital, because that is the most important thing. We've seen in COVID that if you get to hospital in time, before your oxygen levels are really gone, that increases your chances of survival many, many times. So identifying the red flags is very important. When not to stay at home. If your oxygen levels are below 90, even with oxygen support in form of a cylinder or a concentrator, you should not wait. You should immediately start for hospital. If your 6 minute walk test is positive, so usually what happens is when we are walking or exercising, our oxygen levels will go up because your heart is beating that much faster, your lungs are over time working, you're breathing that much faster. So if your resting oxygen levels are say 96, when you start exercising, they should be above 96. But if they start to go down, that means your lungs are compromised and you will need oxygen support in the next couple of days. If they are going down by more than 4 points, that means that this is an emergency now and you should start looking for a hospital bed. Even if your oxygen levels are fine, if the patient is somnolent or confused or completely comatose, he's not responding to you, or he's not responding in a proper way, you should not keep the patient at home. If the color of his skin is changing, like is becoming very pale, or bluish discoloration of lips and nose and fingernails, that is the time you should go to hospital. If the patient is complaining of severe chest pain or anxiety, ghabrahat, diaphoresis, that is a lot of sweating, all these symptoms are there, even if the oxygen levels are fine, you should not be at home. So you should immediately go to hospital. So these things are very important to keep in mind. And I think this is where step one comes in, because step one, when we do the initial call out, so we do COVID positive triaging for almost 18 state governments now. So as soon as you are detected positive, one of our doctor calls you and our doctor informs you of the report. So this has been praised very highly in the Delhi model in the previous wave, in the Mumbai model in this wave. So step one has been collaborating with these governments very, very intimately. So the doctor calls you to inform you that your report is either positive or negative. Because when you get a report, you have two types of behaviors usually. The first type of behavior is you are not at all bothered and say this is all fake. I don't even want to know what my report is. Many people don't even go and check their results, and they're roaming around and going to market and everything. And even if they know it's a positive report, they'll say, oh, I will need to be isolated at home for 14 days, so I might as well go out and buy my essential supplies. So they will keep going out and become super spreaders. The second reaction is the complete opposite. You get to know the report and say, I'm going to die now. And you go and run around and find a hospital bed. And, we've seen actually people running around, their relatives going and booking 3 beds in 3 different hospitals for one patient. So they will block the beds necessary for the really deserving patients who need that bed. So step one, doctors call out these people, identify who are likely to be super spreaders and tell them the positive, correct behavior. Who are panicking, they assess them and whether they really need a bed or not. And then identify and explain all the red signs to them, that, these are the red flags that you have to look out for. If there is anything of this sort, you immediately call us back. And just the reassurance that a doctor is speaking to you and I have a number to call back this doctor and I can speak to this doctor whenever I want, makes almost all of them very relaxed, and they will stay happy at home. They will not overload the public healthcare system unnecessarily. And this is the exact reason why we were able to reduce the Delhi home isolation deaths to zero. There were zero home isolation deaths in Delhi because the helplines were working so well. When we started out, the ETA of an ambulance arrival in Delhi was around 2.5 hours. We reduced it to 15 minutes because of the efficiencies built in, because of the collaboration with the ambulance drivers, because everything was working on those helplines and WhatsApp groups. So the fact that you can reach out to a doctor, the fact that the doctor can assess whether you really need an ambulance, whether you really need a bed, and the fact that the ambulance is now getting only those filtered calls in rather than everybody calling, and there are prank calls also, and ambulances are running around and not finding the patient at all. I think these factors ensured that the patients were well taken care of.
Right.
So health at home is something that is, I think, absolutely necessary. It has not been built as part of the public healthcare system, unfortunately, till now, because of a variety of reasons. But I am sure that in the immediate coming future, especially with this extreme overloading of the healthcare, the institutional healthcare system, I think the health at home will be a major policy decision that the governments will also have to take, and the private healthcare providers will also have to take. It will be a necessity for them rather than an add-on service.
Right. I want to ask the both of you one thing. Everyone I speak to, everyone I've spoken to so far also have said that, it's It takes a community. It takes a whole community effort. It is a community effort. It's the only way that, we can fight or even look at, preparing ourselves for the third wave or whatever that comes next. So, from both of you, I'd like to understand what kind of community efforts and steps that people can take in their own maybe apartment complexes or, societies and colonies. What can they do? Mudit?
Yeah. So, I think, I'll leave this particular answer to Dr. Bajaj. I'll tell you what I'll do. I know that part. I still am not a, expert in epidemiology that, I can say or command what can be done. I certainly don't know that, but I know what I'm going to do, right? So, we have seen in front of our eyes the entire, institutional healthcare infrastructure falling apart, right? We want to, as Dozee, we have taken one initiative called Million ICU, right? In this entire process, the one thing which we felt, the shortage which was there is there also, and it was always there. Trust me, it was COVID just exposed it. We were never great in terms of the infrastructure that we had. And I regret that it had to really come down to this, right? We should have woken up much earlier, but nonetheless, we are trying to do that on our end. So Million ICU is a step to create 10 lakh step down ICU beds. So we are going to put 1 million. We are going to upgrade 1 million public hospital beds in wards into a step down ICU. That is one initiative that we have taken. It's an ambitious goal, but by the end of this year, we are at least planning to put out 50,000 units, so that never again there is such a issue or crisis that one ICU bed is not available for anyone in need. So that is something we are going to ensure. We are in fact collaborating with many foundations, funders as well to enable something like this. In fact, even state government, central government are coming ahead, and they are supporting this initiative. So something that we are going to ensure that never again an Indian has to wait for an ICU, or there is a shortage of nurses or doctors. That is something that at least we would like to do.
That's amazing, Mudit. That's amazing.
Great initiative, Mudit. Thank you very much. But yeah, as a healthcare provider, so as my day job, I work for StepOne during the nights usually. So we've had many all-nighters in the last
I,
year.
I think all
Uh,
doctors have had all-nighters, right? If you are answering calls, if you are looking at patients at hospitals, it seems like I don't know how you're getting the superhuman strength to do this. It's
Certain.
tough.
As I said, it's been just pure adrenaline. We were working on pure adrenaline, didn't even have the time to think. But as my day job, I run a group of hospitals.
Mm.
We have 15 hospitals across 4 states of North India, especially in small towns. So I really appreciate what Mudit is saying, that we do not have the infrastructure, and we really struggling on that front. But I mostly do critical care, right? Because we have hospitals in small towns where no critical care facilities are available. People are forced to travel many hours to access healthcare, so the golden hour is completely lost. I mean, if, for example, you're unlucky enough to have a heart attack in, say, Uttarakhand, you have no choice but to hire a jeep and start traveling down the hills, right? Because there is no ambulance also available, so you'll be just traveling for 4 hours, 5 hours with a heart attack patient and a prayer on your lips that you will maybe reach the hospital. So we do a lot of that critical care because we take these hospitals with cardiology, neurosurgery, intensive care to these small towns so that people don't have to travel. But my heart is well and truly into preventive and primary healthcare. So even though I really appreciate what Mudit said about adding ICU beds, I am more towards leaning towards Sindhu's side on what people can do at their home, in their apartment complexes, to prevent actually,
Mhm.
having you that disease. Because costs of disease can never be lowered by good quality tertiary care. So
Yeah.
whenever we open a hospital, so we opened a hospital yesterday in Haldwani. So whenever we open a hospital anywhere, we do a big event, right? Not in these COVID times, but usually it is the biggest hospital in that small town with cardiology, neurosurgery, everything. They've never seen those facilities. So I only ask one question from everybody sitting in the hall, that what would you rather do? Would you rather have a heart attack and be treated very well in one of these amazing German machines that we are installing here, or would you not have the heart attack at all? So unsurprisingly, the answer is always we don't want to have the heart attack. But the problem is the incentives are completely cross aligned. The community does not want to have a heart attack. The hospital gets paid only if you have a heart attack and you come to the hospital, right? So nobody's incentivizing the doctors to make sure that you do not have the heart attack. So I think this education is very important in the community. As you said, the apartments, what they can do is make health education a part of their cultural lifestyle. It's not just celebrating Navratri and Diwali and Eid, and you should actually have healthcare education as part of the lifestyle. You should prioritize your gym over your club, right? So if you're having some open air space, instead of making it into a club with a bar and a restaurant, try and install a gym there, which is important. Try and install jogging tracks around your hospital. Try and incentivize healthy eating habits. Try and educate children on the importance of healthcare, importance of exercise, importance of healthy eating. I think these will go a long way in preventing the bigger pandemics that we have, but which we ignore. So diabetes, I think, is the biggest pandemic that India has ever faced, and it is still facing. Kidney failures we speak of, right? So we are happy that the government says we will offer free dialysis services in these 100 hospitals, or some insurance scheme says that we will offer free dialysis for you in this insurance scheme. We forget that diabetes is the leading cause of kidney failure by far.
Yeah.
What are we doing to ensure that you spend those 50 rupees and get your blood sugar levels checked continuously, right? Instead of offering you free dialysis. A patient comes to us in a small town with a diabetic foot, and we are amputating one foot every minute across India because of diabetes. The diabetic gangrene that happens, it leads to complete blackening of the foot, and there is no other way except to cut it off. If the patient comes in and we say, oh, we'll amputate this with Ayushman Bharat scheme, and we are a very good hospital chain because we do all these free services. So it's not really a good thing. It's not happy thing that we are saving that 25,000 or 50,000 surgery cost for him. We are forgetting all the immense costs that he will bear. He will go back home and now he's out of a job because he's lost his foot. So he can't go to the factory to work. So he's lost future earnings worth lakhs of rupees, right? Who will compensate him for that? And the scariest part is that indirect, intangible cost of the disease, because when he is out of job, he will pull his children out of school and send them to work. So one of my work people who works with me, he drives a car for me. So that is his story. He said, my father died very early. I don't know what, maybe he had a heart attack. So my mother said, now you can't go to school, you have to work. If he had kept studying, he may have been earning, much, much more than what he's earning now. This is what happened to us, right? My father and mother came to India with nothing but the shirts on their backs. They were like refugees who had nothing. My father used to stay on the roof of a stable for as long as I can remember, and everybody had to climb a rope to get onto that roof. But he made sure that we studied. I shudder to think what would have happened that if he had died early and we were not allowed to study and become, doctors and things that we could never ever dream of, and set up all these things now, which we could never have done if the education had eluded us, right? So these causes of the disease are very, very deep, which
Absolutely.
we
Yeah.
completely ignore.
Yeah.
So these setting of ICU beds, of course, important. I'm not saying it is not, but spending on the other side, the preventive and the primary care, which nobody is incentivized to. So in the Indian healthcare spend that you see, almost 83% of the spend is on curative sick care. There's nothing on preventive healthcare, unfortunately.
Correct.
I think the community needs to take more ownership of that and set that up in their surroundings and their houses, rather than setting up oxygen banks and ICU beds in the apartment block, which most of us think of reflexly.
That's actually a food for thought for all of us, Dr. Sachin, but that's amazing. Both of you are doing great, great work during this pandemic. And while you are saying it's the adrenaline that is keeping you going, I want to understand. I'm sure Mudit also, because last time I spoke to Mudit, he was in a hospital testing the product, working with the doctors himself. There's little spoken about that of what people do on ground, and also it's great. It's a great effort that many people are doing. So I want to understand from the both of you, maybe start with you, Mudit, and understand on, what are your top learnings from this pandemic?
So, I would start from what Dr. Bajaj was saying. Prevention is always better than cure and always much more cheaper as well.
Yeah.
Always first priority should be that, right? And as much as we can prevent, it's always good. Having said that, our infrastructure should be ready for worst. Both are as and equally important. I hope, that is something, which we always balance it out very well. So one of the learnings, of course, is how we can think long term, right? As I mentioned, right now we are thinking COVID because COVID is on top of our mind, but we have to be ready for a lot many things, in next 2 years. I would say many things that we have not seen as well, right? Uh, and that's something I would say that pandemic has really taught me. Things are changing every day. We have to make it a life, a part of life, that how changing things we can still thrive on it. Trust me, even as a business owner as well, I never know what where next lockdown is going to be implemented and everything. So many uncertainties are there, right? But yeah, still how we can get going. When we come out of it, right, I think we as a nation will be much more stronger. But
Yeah.
let's get out of it first. So
Yeah. Rightly put, Mudit. Let's get out of it first. Uh, Dr. Sachin, what is your learning?
I think the most important learning I've had is that there is innate goodness in all humans. You just need to channelize it and show them a path that this is the path to you can walk all together and make an impact. Usually each one of us thinks that what can I do alone, I have the best of intentions, but what can I do? I can't even go out of the house. How can I help people? My help will be too small to make a difference. But if there is a movement that promises people that you can make a difference, I think everybody wants to be a part of that. So StepOne started as a small WhatsApp group
Yeah.
last March, and we people said that okay, let's think of something that how can we help the community, because this pandemic is going to come and hit very hard. So let's see how we can help. And it started as a voluntary kind of an engagement with people, and it's still 100% voluntary. We have no office, we have no salaried employees, we have no office bearers. I haven't met 99% of the people yet ever in my life except online. Everybody works from their homes and their phones. And we have more than 10,000 doctors now volunteering on the platform, completely free of cost. As Mudit said, making, including IVR calls, we are having a traffic of more than a million calls a day,
Mm.
working with 18 state governments. So it's just amazing. And not just doctors, there are techies on the platform, thousands of them who develop all this technology and work on the software, work all night to clean up the bugs which the doctors slam them with during the daytime, and doctors are very very
I can relate to that one.
so the techies work all night, poor guys. And then we have nursing volunteers, we have paramedics, we have mental health counselors, hundreds of them, doing mental health counseling for COVID patients as well as healthcare providers. So the innate goodness of all these humans, they're not getting paid anything. They're not even being recognized by anyone, right? All these helplines work as state government helplines. There's not even this name that it is a StepOne helpline. So all of these helplines work in the name of the state governments. Nobody needs any recognition, or it's just that people realize that everyone is doing it for free. See, once your brain becomes, no, he's earning money out of that and I am working for free, then nobody works. So everybody is working for free. That is what I learned, that there is this innate goodness. And then the second thing I learned, as I told you earlier, is this resilience among people. They're very, very brave.
Mm.
And I think this is something that Indians have this unique ability. The darkness of the last month was unbelievable, especially in North India. I
Yeah.
mean, you had to see it to believe it. I have never felt so helpless ever in my life, ever. I mean, I would just, I was like, what is happening? But the communities all stuck together. There was no violence, no crime. Nobody was, like exploding with anger. People were dying at home. People were dying in the streets. People were dying in ambulances. But everybody was very resilient, and especially the healthcare workers. I think, as I said, even when they were sick, they were saying that it's a good thing that I've now become positive. I can work without a PP. I will be in the ward, but I will take care of the people around me. People were losing their loved ones, but still coming back to work in a day. So the resilience, the braveness of humans, I think, is something that we underestimate. Once it comes to it, once you're on the edge, you discover so much more about yourself than you thought you were capable of.
True.
So I think these two things have been the learnings that I am taking home from this pandemic. And as Mudit said, hopefully we'll come out much stronger. As long as we come out now, I don't think we are willing to face another wave at all.
Yeah, and I hope that everything in terms of vaccinations and everything steps forward. But you have raised a pertinent point on the mental health of healthcare workers, healthcare providers, and maybe that's another longer conversation. But I hope everyone finds something that keeps them going and moving forward. And I hope we do come out of this as soon as possible. Thank you so much for your time, Dr. Shuchin Bajaj, and thank you so much, Mudit, especially considering both of you are working 24 by 7. I know that for a fact. So thank you so much for the time, and thank you for taking your time
At
out.
one point, Sindhu, I just want to add last one point, right? So which I
Please.
noted down while Dr. Bajaj was saying.
Uh,
Dr. Bajaj, one more dream I have to change. So next time a hospital opens in Haridwar, they don't have to flaunt about a German technology, but an Indian one. So yeah,
Yes,
good,
so
good.
that also I'll ensure. So yeah.
yes, I wish. So I talk about this a lot. See, how can you offer healthcare services at low cost when everything you the patient walks in, you register him on the computer that's made in China, you do an X-ray that's made in Germany, you do a CT scan that's made in the USA, you take him to a cath lab that's made in Europe. Everything is important. What do you do? I mean, how do you make sure that the costs are low when nothing that you're using in the hospital is made in India? So we desperately need Indian technology, Indian instruments. So hats off to you, Mudit, for starting this wave. I hope this is a transformational wave, and we all get a lot more Indian equipment in the years to come.
Yeah.
Yeah, it sounds great, and I hope our healthcare systems not just survive but also thrive post this pandemic. And we are geared up for whatever waves that come in with more people getting vaccinated. So, anyone listening, please go get yourselves vaccinated and stay safe, stay at home. Thank you so much. Thank you for your time.